I'm Dr. Chester Frank Griffiths, Chief of Endoscopic Sinonasal and Skull-Base Surgery at the Brain Tumor Center at St. John's Health Center in Santa Monica, California. My associate and partner, Dr. Creamy, and I play an important role in the St. John's Brain Tumor Center and Pituitary Disorders Program to work in tandem and in parallel with Drs. Kelly and Barkoudarian in the surgical treatment of patients with pituitary tumors and related skull-base tumors. Our close collaboration has come about largely because of the rapid evolution of endoscopic technology and anatomical understanding of the skull base and pituitary region. As Chief of Endoscopic Sinonasal and Skull-Base Surgery, I also provide pre- and post-operative sinus care for patients undergoing endonasal surgery.
When I met Dr. Griffiths, I found him very engaging, first of all, great bedside manner, fun to be around, very conversational. Beyond that, I also found him very knowledgeable, very credible, gave me a sense of being very forward-thinking, maybe on the cusp of technology as opposed to following it.
As a result, our specialties have joined forces in a multidisciplinary treatment paradigm to treat pituitary tumors and related skull and sinus and brain tumors. By combining the expertise and experience of ear, nose, and throat and head and neck surgeons with that of the neurosurgeons, we now have truly raised the quality of surgical care for these complex conditions. Our emphasis is to reach the tumor as directly and safely as possible while preserving your normal nasal and sinus structures. So how does this collaboration work? As your ear, nose, and throat surgeon, I will see you both before and after surgery. In our initial visit, I'll review your preoperative imaging, which may include the MRI or the CAT scan. We will discuss your nasal and sinus anatomy and the approach to reach your tumor. This discussion will complement what you've already learned from Drs. Kelly and Barkoudarian on how your tumor will be removed, also how the skull-base closure is performed, and what to expect after surgery. We'll review with you how to maximize recovery of the nose and sinus structures. During your surgery, I'll perform the initial approach, providing the pathway to the skull base and pituitary region. Then, using my endoscopic view and my cinematography, if you will, Dr. Kelly will complete the exposure of the tumor, its removal, and the closure of the skull base defect. On your first postoperative visit, typically 7 to 10 days after surgery, you'll be seen both by neurosurgery and ear, nose, and throat. At the ear, nose, and throat visit, we will clean out your nasal cavity and generally try to help the healing process of the nose and sinuses. We will then typically see you 2 more times at 2-week intervals. We believe there are many benefits of this neurosurgery, head and neck surgery team approach. First, by combining our experience, we believe the level of surgical judgment and expertise are raised, and second to none. We are better able to solve challenging problems and jointly avoid complication. Lastly, sinus and nasal care is enhanced, given our long track record in head and neck surgery and treating sinus disorders.